Hi everybody, my name is Fedi Abdelmajid and I'm going to be giving an informative speech on periodontal disease. Imagine losing your teeth, but not from an accident, but from bacteria you didn't even know existed. They're tiny and they're living right underneath your gums right now. The purpose of my speech today is to educate everyone on periodontal disease, what causes it, how it affects you, and overall, what's more importantly, how we can treat it. Why did I choose this topic? Well, currently I'm pursuing to become a dental hygienist, and the dental hygienist is the individual who treats periodontal disease at the dentist. Why does it matter to us to explain what this is? Well, nearly 1 in 2 people over the age of 30 in America currently carries a form of periodontal disease right now. And it's not just about losing your teeth. The infection can be linked to things such as heart disease, diabetes, and complications in pregnancies. I've studied microbial causes of gum disease and seen what it does to you, and I can tell you what its real world problems is for us. Today I'll cover 4 main points: what periodontal disease is and how it develops, who are the microbial villains behind the disease, and how it impacts the rest of your body and how we can prevent it. What is periodontal disease? Periodontal disease is a chronic bacterial infection that targets your gums and tissues that support your teeth. It usually starts at as gingivitis, and that's when your gum turns red and swells up and bleeds easily from something as simple as brushing your teeth or flossing. If left untreated, it can progress and become periodontitis, where the infection can go deeper into your gums and damage the bones and the tissues behind it. As you can see here, this individual has lost some of his bone, and you can see that dip right there. But this disease does not just stay in your mouth, it can move thoroughly through the rest of your body. This is terrible right now. All right. The main microbial causes are periodontal disease. The diseases are born from Prophy romanus gingivals. These are the diseases that evade your immune system and trigger inflammation. So if you ever notice people's gums being swollen, that is that microbe. Another microbe is Tanner L. Folastia. It produces enzymes that destroys your tissue and help build bacterial defenses. Tripamone denticola is a subcrotis that moves throughout the tissues and disrupts your body's immune system. But these bacteria don't just float around, they form biofilm. And what is biofilm? It is essentially plaque, that film that comes across the back of your teeth. Once it's built, it is tough to break down. Antibiotics struggle to destroy it, and even your immune system can't do much about it. And as long as it stays, it fuels chronic inflammation and ongoing tissue damages. And like I showed you in this picture, this is actually a skull of an individual from ancient Egypt 4,000 years ago. This disease isn't something relatively new that we've been treating. We've been trying to tackle periodontal disease since the ancient times. But the real danger is what happens to the bacteria when it moves beyond the gum. Let's talk about the systematic issues that occur. The 3 main systematic health problems are linked to cardiovascular disease. Bacteria can move from your gums down to your bloodstream and enter your blood vessels and create inflammation and buildup. It can also cause diabetes. High blood sugar weakens your immune defenses, which worsens your gum disease, and the gum disease can be detrimental to people with diabetes and have a harder time managing their gum health. weirdly enough, it also can cause complications in women's pregnancies. Periodontal infections have been linked to premature birth and low birth weights in children from parents who suffer from periodontal disease. But who are the people high at risk? The people who are high at risk are smokers. Smokers are 2 to 6 times likely to develop periodontal disease. People with diabetes are especially linked to poor hygiene, or could potentially be linked to poor hygiene in the mouth with diabetes. And genetic predisposition, when that is when somebody could be naturally overreactant to plaque. It could be caused from genetics, or it could be passed down from a parent, something like that. And worst of all, poor hygiene. If you're not brushing, if you're not flossing, you are going to be one of the people who leads into periodontal disease. It sounds intense, but there's good news to it. There are ways we can treat it and prevent it from happening. The biggest things we can do to prevent it is brushing twice a day and flossing once a day, going to the doctors at least every 6 months to do your daily your checkups and your cleanings. Also, another way you could do it, you can stop smoking. Smokers are linked to it, so another reason they can prevent themselves from gaining it is by quitting smoking altogether. And make sure you're eating a healthy diet and not constantly eating junk food, donuts, and things like that. Questions afterwards. If it has developed really badly, you can always do 2 things: non-surgical treatment and surgical treatment. A non-surgical treatment will be something called scaling and root planning, which is a deep cleaning that goes below the gum line using antimicrobial rinses such as chlorhexidine. If it's an advanced case of periodontal disease, there is things called surgeries that we can do, called flap surgery. It's where they have to actually lift the gum and remove the tartar and plaque from the deep sides of the gum right there. Also, if you want to regain that bone that you lost, you can do bone grafting and regenerative tissue regeneration, which helps rebuild what was lost. It won't fully reach its same goal or its same point as it once was, but it can bring your gums level back up to a healthier position than it once was. But yeah, one patient with advanced gum disease underwent deep cleanings and flap surgeries. Over time, their dental health was stabilized and all their inflammation went down. So there is hope, even if you have to do surgery and just get back on your health. You can clean and get to healthier gums once again. Overall, the reasons why this matters is, again, I'm trying to become a dental hygienist. I want to make sure people are healthy and are not reaching these types of diseases in their mouths, since it is a very common disease. In conclusion, as I wrap up here, is what I have to hope our takeaways are. Periodontal disease often starts small, but can lead to tooth and bone loss. Bacteria forms biofilm that resists treatments and trigger inflammation and other damages in the mouth. This condition can cause heart disease, diabetes, and potential problems at birth. But with simple cleanings and your constant maintaining that relationship with your doctors every 6 months, you can prevent this from happening. And lastly, one mouth, one body, one heart, and they're all connected. And thank you for your guys' time.